Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Just like humans, our pets have to deal with some serious skin issues. On today's show, we will take a closer look at taking care of their furry coats, and we will share tips on how to keep pets safe and healthy. And we will also answer your pet health questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed. Hello, and welcome to Ask the Doc, No Appointment Needed, the health show where the questions you send in are answered by our doctors and medical experts. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and thank you so much for joining us today. Let's get right to your questions. Our first question comes from Terrence, who emailed us, and he asked, I just rescued a kitten from the streets and she's missing a lot of her hair and the tips of her ears are crusty. I have an appointment this week to have her checked out. What could this be? All right, Terrence, thank you so much for asking this question. So my top concern is certainly going to be that maybe this kitten might have scabies, okay, or what we call sarcoptic mange. It's very common, particularly we see it a little bit more in cats than we do with dogs, but a lot of times we see it with cats that are stray animals. Usually they will be very itchy. They're going to have crusting around the ears, sometimes around the eyes. They can have it like all over the body, anywhere. Now, the thing about sarcoptic mange or scabies is that it is contagious to humans, okay? So with that being said, you need to make sure that you're wearing gloves or washing your hands very well after petting the kitten, okay? Because it can be passed on to you. The good thing is that it's very easy to diagnose. Usually it's diagnosed with a skin scrape, okay? And that can be easily done at any veterinarian office. And then the treatment is actually just as easy. Typically, we usually will do some topical medications that we use for fleas in cats, in particular Revolution, Brevecto, I think Advantage Multi. They're kind of off-label, but usually you only have to put 1 or 2 doses of those medications to get rid of it. There's also ivermectin injections. There's even some topical medications and things like that. But whatever your vet, decides, obviously go with that recommendation. So the big thing is just make sure you're keeping the kitten away from any other pets in the house. And then the same thing that you are using gloves and washing your hands very well until you get her checked out, until you get this treated, okay? Hopefully it's not mange, but if it is, if it's sarcoptic mange, it's very, very easily treated. So good luck, okay? All right. Our next question comes from David, who emailed us with this question. I heard dogs and cats can get skin cancer like humans. Is this true? If that's the case, do I need to put sunscreen on my dog? All right. So yes, definitely there are some types of skin cancer in dogs. In particular, squamous cell carcinoma and melanoma are the 2 number 1 that we see. And then I would say also mast cell tumors. Now, with squamous cell carcinoma and with melanomas, it's kind of multifactorial as far as what causes a pet to develop cancer. What that means is it's not just one particular thing. Definitely, they do think that sun exposure has, it's one can certainly contribute to them developing those types of cancer, but it's maybe not necessarily the sole cause of it. With that being said, okay, pets that are at more risk for developing those 2 types of cancer are going to be your breeds of cats that really have no to little hair. So those funny little Sphinxes and the Devon Rexes and things like that, those are going to be the ones. And then any dog who does not have a really thick coat or fur, and particularly has light skin. So you tend to see it a lot of times in American bulldogs that are white in color. You can certainly see it in pitties. I mean, you can see it in any breed, but most of the time dogs that don't have very dark skin, they're white skin, and they don't have a whole lot of hair. Now, As far as sunscreen goes, there are some products out on the market. I personally have never used any of them, so I can't give you the best advice, but you can certainly look online and do your own research. As far as using human products, that is certainly fine. You just have to make sure that it's something formulated for basically babies or for children, because you want it to be non-toxic if they are to lick it. And they typically say, as far as SPF, anything from 15 to 30 is going to be adequate for your pet. One thing I did want to mention though is a lot of people, their cats are inside, okay? But they like to sit by the window and they like to sunbathe. If you have a cat that is a Devon Rex or is a Sphinx or whatever, you need to try and limit that amount of time that they are at the window, because they can get sun exposure and they can get predisposed to those cancers like that. All right. So thank you, David, for that question, and good luck with everything. All right. All right, our next question comes in from Jennifer, and she asks, my vet tells me that I should have my dog and cats both on flea prevention, even though my cat doesn't go outside and my dog only goes to use the bathroom. What do you think? Okay. All right, Jennifer. Yes, 100%. Okay. You need to have your pets on flea and tick medication. All right. It is hot all the time, pretty much in South Florida. So definitely ticks are always a problem. Fleas are always a problem. And then mosquitoes with heartworm are always a problem. Now, even though your cat may not go outside, all right, you go outside. Okay. You can bring fleas in, just on your clothing, on your shoes, different things like that. And even though your dog may only go outside for a short time period, all it takes is for one or two fleas to jump on your dog. And next thing you know, they lay eggs, and then those eggs hatch, and then you've got a bunch of fleas and you've got an infestation. All right. The big thing is there are a lot of diseases that can be deadly that are transmitted by fleas and ticks. In particular, they're typically called rickettsial diseases, okay? Ones that I'm talking about would be Bartonella, okay? Also known as cat scratch fever, so it's not just a Ted Nugent song. It is actually a disease, and it can be transmitted from your cat to you, okay? So there is a zoonotic potential. Other things like babesiosis, anaplasma, ehrlichia, which can affect both dogs and both cats. Different types, they're called mycoplasms, that are diseases that are transmitted by fleas to cats. They can certainly cause a lot of problems. They can cause organ failures. They can cause really severe fevers. They can cause severe anemia to the point that you need to see about getting a blood transfusion for your pet. So they can be very, very serious. All right. Not only just to your pet, but just to you. All right. And the thing is, it is so much easier to prevent fleas and ticks than trying to get rid of them if you get an infestation. Okay. And the flea and tick medication these days, there are a lot of new products that are safe. I don't care what people say online. People will post anything on Facebook groups. Okay. Talk to your veterinarian if you're concerned about which product to use. There are topical products, there are oral products, there are even some flea and tick collars that are prescription based that I recommend. Okay. So whatever you think is going to be best for your pet, talk to your vet and kind of express those concerns. But they are safe, I promise you. The risks, the benefits, I should say, outweigh the risk way more than anything. And I have certainly seen pets, unfortunately, pass away from some of these diseases that are transmitted by fleas and ticks. Okay. So definitely get them on prevention. It is pretty inexpensive these days and it's very easy to get. And there are a lot of different options out there, Jennifer. Okay. All right. We just got a question from Leslie, this time from our Facebook page. We adopted a dog from a local shelter and the vet found out that he had ringworm. How does this happen? And what do we need to know about ringworm? Okay, so the first thing is ringworm is it's caused by a specific type of fungus. I'm not even going to try and pronounce it, okay? But if you guys want, you can Google it. It is zoonotic, okay? So that means it can be transmitted from you to other pets or sorry, from your pet to you, and you could technically transmit it from yourself to your pet. It definitely is very easy to typically diagnose. There's a couple of ways you diagnose it. One way, your vet might use what you call like a fluorescent light or kind of like a black light, and will shine it on areas of the skin that maybe possibly have the ringworm lesion. Um, it will sometimes fluoresce, okay, bright yellow, and sometimes it won't. If it doesn't, that still doesn't mean that they don't have ringworm. You can do what's called a fungal culture that they can sometimes run in-house with their lab, or they can send out to a laboratory. It does take a few days for those results to get back, but a lot of times if your vet has a very high suspicion that your pet may have ringworm, they're going to go ahead and they're going to treat them. Treatment can be oral medication, just like oral antifungals that we have in humans. Also, there are topical medications. There's special baths like lime dips and sulfur dips and things like that that can be done for your pet. So even though it is annoying and it sometimes can take multiple treatments to get rid of it, it definitely is something that could be treated. So if you have a suspicion that your pet has ringworm, just go ahead and make an appointment with your vet, let them check everything out, diagnose it, and hopefully get started on treatment. All right. Madison followed up with her email and she writes, my indoor cat has been licking her fur on her side so much that she's losing hair. What's going on? All right, Madison. So it's hard to say without seeing your cat, but the two main reasons that cats will kind of excessively or overgroom themselves, the first one is going to be behavioral issues, and the second one is going to be some type of allergy. So you definitely want to make an appointment with your regular veterinarian, okay? Because they're going to want to find out history, do a full exam, maybe even some lab work, other things like that. Now, if it turns out that it is behavioral, there are some medications you can put your pet on. There is something basically like kitty Prozac, okay, fluoxetine, and there's some other medications too. Now, if it turns out that it's allergy related, there are medications for that. In particular, cats are very, very sensitive to fleas. So another reason why to get your cat on flea prevention, all it takes is one bite from one flea, okay? And that saliva can cause a very intense reaction, so much to the point that they can scratch themselves crazy, they can lick themselves, like remove all their hair, they can have skin lesions, like it can be really bad and very uncomfortable for your pet, and all it takes is one flea bite, okay? Typically, that is usually very easily treated, getting them on flea prevention, sometimes anti-inflammatory, steroid injections, things like that to help with kind of the itching. If it is maybe environmental allergies or what we call atopy, that can sometimes be a little bit harder to diagnose, okay? There are some blood tests out there, but there's a little bit of controversy on that as far as with dogs and cats on how accurate those blood tests are to determine if a pet actually has allergies and what they're allergic to. The good thing is there's some new medications out there that no matter what they're allergic to, it kind of blocks the inflammation. One particular in cats is called Atopica. It's a daily oral medication that definitely is fairly safe. There are some side effects that aren't too bad, but that's something to talk with your vet about. But the problem is, it is a daily medication. But it's not necessarily so bad having you give your cat, a medication just once a day. All right. Other thing it could be food allergies, just like in dogs. All right. And so your pet may be allergic to the source of protein that is in the food. So they may want to try like a hydrolyzed diet, or what we call like a hypoallergenic or a novel protein diet, different things like that. Okay. So hopefully it's not anything that serious, and I really don't think it is, but definitely, Madison, you want to get your kitty cat checked out because it could be allergies, and there's definitely some steps and treatments and things like that that can be done to keep her from over grooming herself. Okay. All right. Vivian emailed in with a question many of us can relate to, and she writes, I have a rescue pit bull that is so sweet, but he keeps getting ear infections and rashes on his skin. I've changed his food to an organic brand, but it's not helping. What else can I do? All right, Vivian. So I kind of touched a little bit on this with the last question. So your ears are an extension of your skin. And what that means is if your pet has an allergy, not only will they sometimes manifest with chronic ear infections, they can certainly have skin problems also. Okay. There definitely are some breeds of dogs that just get ear infections because they've got floppy ears, they've got hair in the ear canal and different things. But usually with a pit bull, their ears stand up. And so it's usually not an issue as far as, with the conformation of their ear or the ear canal. So my suspicion would be that he might have some type of allergy. Now, typically it's either the food or it's environmental allergies. And the fact that you're feeding an organic brand of food is great, but it really does not matter. You can put your pet on the most expensive, luxurious brand of food. And if they are allergic to that source of protein that's in the food, they are going to react to it. So typically we are concerned that it's food allergies. We will put them on a hydrolyzed diet, like I mentioned before, something hypoallergenic, but you have to put them on it for a minimum of about like 6 to 8 weeks, and they can only eat that diet. Okay. There are some treats that are hypoallergenic. So if you want to give your pet treats, just talk to your vet about getting a prescription for that. And after about 8 weeks, if we're not starting to see a response, say the ear infections decreasing or the skin issues, things like that, then it may be more environmental allergies. And what I mentioned in cats, what we call atopy. All right. Like I said, there is allergy testing that can be done. It's not really done that much anymore. If you're going to do allergy testing, I recommend going to a board certified dermatologist. And yes, there are veterinary dermatologists. Okay. And they will actually do a skin test, kind of like what they do in humans when they prick your skin a bunch of times with the different kind of allergens to see what you're allergic to. That is definitely more accurate than these blood tests that a lot of companies, are kind of advertising. The good thing is you don't necessarily have to figure out exactly what your pet is allergic to. There are medications out there that will block the inflammation from even starting and help with the itch. In particular, it's called a JAK or a JAK1 enzyme inhibitor. Okay, there's two newer medications: Cytopoint, which is an injection, and then you have Apoquil, which is the oral version, and then there's even a new one. I think it's called Zenrelia. That's a little bit less expensive than Apoquil. I'm not even going to try and say what the generic, name of the medication is because it's kind of a little weird, but you guys can look it up. Okay, but those medications basically block the inflammatory response. All right. So whatever your pet is allergic to is going to help with that. All right. So, skin allergies suck, and they definitely are not something fun to deal with. I will say this: if your pet does have allergies, whether it's to food or to things in the environment, there's no way to completely 100% eliminate it. The best that we can do as veterinarians is try and decrease the symptoms and kind of the outbreaks. When I say the outbreaks, like when they break out with a rash, when they get an ear infection, when they're very itchy and things like that, it's just way too hard to completely eliminate everything, but you want to make it to where your pet is comfortable the majority of the time. All right. So Vivian, definitely see about getting your pity checked out. Okay. All right. Erin reached out through Instagram and she writes, my 12-year-old Maltese's fur is thinning out and she barely has any fur on her belly. Is this because of age or could it be something else? All right, Erin. So it is definitely a possibility. It could be age. I mean, as humans, when we get older, our hair tends to thin too. But I am a little bit more concerned that your pet may have some type of endocrine disorder. This has to do with hormones in the body. The two most common ones that we tend to see that can affect their fur and their coat and the skin is going to be hypothyroidism. So that means they are not producing enough of the thyroid gland. It's very easy to test, okay? Sometimes some vets can test for it in-house depending on what blood machines they have. If not, they can send it out to the lab, get results in 24 to 48 hours. It's very easily treated. Basically, you treat it with thyroid hormone, okay? And usually that's given once daily. The other disease that can cause sometimes issues with the skin and with the fur and the coat is going to be Cushing's disease, okay? This is a type of endocrine disorder where your body is producing too much of cortisol, also known as kind of the stress hormone. So it can affect a lot of different organs in your body, but in particular, we can certainly see on the skin of dogs that they start to lose their hair, especially around the belly and definitely around like what we call the flanks or the side areas. You might even notice your pet maybe having a belly that seems a little bit kind of descended, kind of like a pot belly type appearance. Sometimes they drink a lot of water, they'll urinate a bit, and a lot of times they'll have an increased appetite. All right. So the best thing to do is, since your puppy, or I should say your dog, is 12 years old, is definitely take them to your regular vet. Go get a checkup. If they feel like it might be one of these endocrine disorders, they're going to recommend running some tests. The tests are not crazy expensive. And the same thing with Cushing's disease, it is treatable, okay, with a daily medication. So there are treatments and things out there. All right, we got another question that came in, and this one is from Junior, and he writes, my friend's cat was recently diagnosed with diabetes. What are some warning signs that I need to look out for? All right, Junior. So definitely some signs of feline diabetes. So certainly you can have increased or decreased appetite. Weight loss is another one. All right. Increased thirst, wanting to drink water, frequent urination. Sometimes they will urinate outside of the litter box, being a little bit more lethargic, just not quite as active. And I guess if you get close enough to your cat, sometimes they can have a little bit different odor to their breath, kind of maybe a little sweet smelling and stuff. Sometimes they don't want to groom themselves as much, so they can have an unkept coat. And then definitely because of excess glucose in the urine, it predisposes them to getting urinary tract infections. All right. Now, diabetes is easily diagnosed. All right. Typically, the way you diagnose it is going to be with high glucose in the blood and high glucose in the urine. There are some other tests like fructosamine and things like that that your vet may want to run. But usually, like, we can typically diagnose diabetes in the hospital in the same day. All right. Now, with cats and diabetes, it tends to be like type 2 diabetes in humans. So you got a fat, lazy cat, they a lot of times are predisposed to it. Same thing, with humans, with type 2 diabetes. A lot of times it tends to be they're not on the best diet, they may not exercise as much, and they tend to be overweight. Now, with that being said, sometimes you can cause them to go into remission with special food and with weight loss, but that is not always the case, okay? So you definitely need to talk with your veterinarian about what treatment options, are going to be best. Now, insulin is one treatment option. Just like we do insulin injections in humans, we can do insulin injections in cats. There are two other medications that are oral. One is called Zinvalgo and another one is called Bexacat. These are medications that help the cat's body basically excrete the excess glucose through the kidneys and into the urine. There is a little bit of controversy about these medications. They can never have been on insulin before, basically have to be a newly diagnosed diabetic cat. And then I have seen some complications in the ER, which could be for another talk. But you just want to talk with your veterinarian if your cat is diagnosed with diabetes as far as what the best treatment option is going to be for your cat, okay? Our next question is from Alice, and she writes, my dog has irritated skin, and my friend says it could be mange. We're going to the vet this week. Can you explain exactly what that is and what we need to know if it is mange? All right, Alice. So I talked about sarcoptic mange in cats. In dogs, a lot of times we tend to see something called Demodex. All right. That is the mite that causes that particular type of mange. Now, it is a normal mite that lives on the skin, okay, of dogs. What happens is a lot of times we tend to see it in puppies, older dogs, or dogs that have a suppressed immune system, is those mites can start to overpopulate, and then that's when it can start to cause problems. The same thing, like I mentioned with cats, you can see a lot of times hair loss, crusting around the face, the paws, the tail, the eyes, different things like that. And they do tend to be very, very itchy. The good thing about demodectic mange is that it is not contagious to other pets and is not contagious to humans, okay? Like I said, it's a normal mite that lives in their skin that has just started to overpopulate. Now, if you have a puppy, okay, or an older pet, your vet may not be too concerned about the mange. I mean, obviously they're going to want to diagnose it and treat it, but if you have an otherwise healthy dog that has developed mange, then that can indicate there may be something more serious going on that is causing immunosuppression and causing them to develop this. So there may be some other tests they want to do. But the way we diagnose it is just like with scabies, we do a skin scrape. The same thing as far as treatment for Demodex mange is almost pretty much the same thing as sarcoptic mange. There's going to be topical medications. You can do ivermectin injections. You can do oral ivermectin. There's a whole list of different things to do out there. Okay. So definitely, I'm glad that you already got an appointment, Alice, getting your dog checked out. Okay. But good luck with that. Hopefully it's not mange, but if it is, remember that it is easily treatable. Okay. All right. JP emailed in with her question, and she writes, we have two dogs and they couldn't be more different in their personalities. Can you explain why one dog barks nonstop and the other hardly barks at all? Could it be something medical? All right, JP, I really don't think it's anything medical. Just like humans, dogs have personalities, and one of your dogs may be a talker and the other one may not be. Now, it could be a little bit of behavioral type things too. Sometimes dogs that are very anxious or nervous or scared or stressed will manifest that behavior with barking. So that could also be that. If you're really concerned, you can certainly make an appointment with your veterinarian, okay? But I really don't think it's much of an issue. If it's definitely becoming a problem at your house as far as the barking is bothering neighbors, bothering yourself, things like that, there are definitely some products out there that can help with barking. There are bark collars. There's not the ones that shock them, the ones that kind of make a more like annoying noise. And there's even some ones basically they will submit sounds that you can't hear, but the pet can hear. Okay. But if it's really bad, then you might want to see about getting a dog trainer. Okay. Unfortunately, that's all the time we have today for the show. Thank you so much for joining us. I'm Dr. Joy Carter, and I hope you guys have a great weekend. And we'll see you next time on Ask the Doc, No Appointment Needed. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.